You know, whenever a contagious disease pops up, public health officials are slammed with one of the toughest questions imaginable. It's this constant, high stakes tightrope walk, trying to protect the health of an entire community while at the same time protecting the basic rights of every single person in it. So, this is the big question, right? This is what we're really digging into here. We're going to break down the ethical framework that guides these incredibly tough decisions. Decisions that, as we all know now, can touch every single part of our lives. Because at its heart, this isn't just about medicine or science. It's a deep, fundamental ethical problem that public health has been wrestling with for centuries. Look, this is never a simple choice between a right answer and a wrong answer. It's all about balance. On one side of the scale, you've got this duty to protect the whole community from harm. But on the other side, you have this profound respect for a person's own choices, their own liberty. And every single communicable disease forces these two powerful ideas into conflict. So, how do officials actually make these calls? Well, it's not random, and it's not just a gut feeling. They rely on a pretty consistent ethical toolkit, and it's built around three really crucial factors. This is basically the formula. These three questions, how does it spread, how bad is it, and can we do anything about it, they form the very foundation of the public health response. The answers are what help determine if limiting someone's freedom is actually justified. Let's start with that first one. How easily does it spread? Just think about the difference between tuberculosis and HIV. TB is airborne. If you're near someone who is sick, you're at risk, period. But HIV needs a direct exchange of bodily fluids. That massive difference is why for TB, you might see interventions that restrict movement, but those same measures would make absolutely no sense for HIV. Okay, so that's the theory, but how does this toolkit actually work in the real world when the pressure is on? Let's look at a few examples. We're going to rewind back to the Ebola outbreak in West Africa. This was a terrifying time that really put this whole ethical framework to the ultimate test. Right, so here, that second factor, the severity of the disease, it was just completely off the charts. Ebola was incredibly deadly. The risk to the wider community was so catastrophic that drastic measures like isolation and quarantine weren't just seen as an option, they were considered an ethical must-do to stop an even bigger disaster. And now for that third factor, what can we do about it? The classic example here is mandatory vaccination. You see this with diseases like measles or mumps. The intervention, the vaccine, is so effective, and the risk to any one person is so tiny compared to the risk the disease poses to everyone, that's when the balance tips toward the community. And listen, this idea is not new at all. This has a legal backbone that's over 100 years old. A huge Supreme Court case basically established this principle. Your right to say no kind of ends where the harm to other people begins. It's a really powerful statement about that balance between your choice and everyone else's safety. But here's the thing. These ethical rules aren't set in stone. They can't be, because science is always changing. And wow, there is no better story to show this than the public health response to HIV and AIDS. This timeline just perfectly illustrates how the whole ethical equation can completely flip on its head. In the early days, there was no treatment, just a ton of fear, and the response was driven by stigma. It was all about protecting us from them. But then, once effective treatments showed up in the 90s, the entire argument shifted. Suddenly, testing wasn't just about protecting the community, it became a crucial tool for saving the individual's life. The focus changed from isolation to treatment. But there's another really important layer to this whole debate, one that goes way beyond the virus itself and gets into the social conditions that actually let it spread. Think about mosquito-borne illnesses, like Zika or malaria. They often hit hardest in poorer communities. The solutions here aren't just about one person's choice. They're massive community-wide efforts. And these raise their own tricky ethical questions about things like environmental impact and who gets to say yes or no for a whole region. And this, right here, is the unavoidable truth that sits underneath so much of public health. Diseases don't spread in a vacuum. They thrive where there's inequity, in places without access to basic resources. And that fact forces us to ask an even tougher ethical question. What's our responsibility to fix the root causes? So, as you can probably tell by now, figuring all this out is incredibly complex, and we are a long, long way from having all the answers. Yeah, this isn't just stuff for the history books. From the seasonal flu every year to the threat of brand new pandemics, this ethical balancing act is something public health officials have to do every single day. It's this constant, difficult, but absolutely necessary process of weighing all the factors: the science, the risks, the benefits, and our freedoms. And really, it all comes back to the most fundamental question of all. And it's not just a question for the experts, it's for every single one of us. In a world where a cough on one side of the planet can cause an outbreak on the other, what is our responsibility to one another? What do we truly owe the person standing next to us?